Hello, my name is Michelle Franklin. I'm the CEO at Sullivan County Community Hospital. I'm lucky to have with me Dr. Steve Dupree, who is our COVID hospitalist here at the hospital. And between the two of us, we'd like to give you some information about what's going on with COVID and anything COVID that's happened over the past few weeks. And as you may know, our county is now a red county, and that happened approximately a week or so ago. And what we are seeing here locally inside our hospital is that beginning in about mid-August, we saw a very, very sharp spike in the number of patients presenting to our quick care. And as many of you know, our quick care has now been turned into nothing but our respiratory care clinic. And so that spike was pretty immediate. And followed by a very high patient volume, we began to see very high testing numbers, as much as 100 tests being done in a day, which is very, very significant over what we saw in 2020. In addition to the number of patients, the number of tests done, as you would imagine, the number of positives that we're seeing have come back very, very substantially. And so just to give you some sort of idea about positives, we've looked at our numbers just between the 1st of September and up until yesterday, and we had 111 positives. When you compare that to the same time frame in August, we only had 59. And unfortunately, what happens when we see more positives, more people being sick, more people getting tested, more positive, that translates into more business for Dr. Dupree and ends up really causing a lot of problems just in terms of visits to our ER and having our ER volume suddenly go up, which then translates, of course, to a positive number, a very high number of people on our COVID unit.
Yeah, we've seen a huge upswing. We've had people die. What's been surprising is that the sickest patients are now in their 40s and 50s. I have a 30-year-old patient who's very sick. I've seen a 3-month-old, a 3-year-old that we did not hospitalize. So this vaccine, unlike last year's, attacks children under the age of 9 very easily, and they spread it very rapidly. If you're in a car with someone who's got COVID, you're probably going to have COVID in 4 days. If you know you have COVID, you should probably look and check in to get in the antibodies at our facility. They may make it so you're not quite so sick, especially if you have health care problems like diabetes, hypertension, obesity, or you just don't want to get COVID. We use everything that everybody else uses. Every night for the last 2 weeks, people call me up from other hospitals asking if we have beds, and we're full. It's come up from the south, and it's definitely in the Midwest, and hospitals are struggling.
Yes, it is. And so Dr. Dupree's mentioned a couple of really important things there. Number one, our respiratory clinic is open for you to have a COVID test if you're experiencing symptoms. And that does require a doctor's order. If you present to quick care with a doctor's order, then you will definitely be able to get the test. If you come into quick care and you're sick, we will want to see you inside the clinic and check your symptoms and make sure that we think that we need to test you. Our test turnaround time has been about 2 days, which is really great. That's been quick considering the very large number of tests that are being ordered. And then, as Dr. Dupree mentioned, if you turn out to be positive and go home and become sick, you either could be admitted, perhaps, or you could also have the outpatient therapy for infusions. And we're very fortunate inside our hospital to have a couple of options to have infusion treatment on an outpatient basis. And so in order to do that, you can call the hospital to question that, or more importantly, call your physician if you're getting sicker. Come to the ER if you feel that's necessary, and then either the physician or the ER can evaluate you for appropriateness of that infusion. Would you have anything else to say about that,
it's
Dr. Dupree?
It's important to get your diagnosis early so you can be treated early, and so you can isolate so you don't get everybody else in the household and all your friends with COVID. I had a student hide the fact that he had COVID to play football. His mother got him the COVID vaccine, which makes you very sick if you have COVID. So it's not an idea if you're sick to go get the vaccine, but when you have IV infusion drugs, antibodies that may help you get well quicker. Of course, children usually don't get that sick, but some of them do. And definitely 30, 40, and 50-year-old people get just as sick as 70 and 80-year-old, maybe this year worse.
That's right. And, Dr. Dupree has been wonderful about mentioning the importance of the vaccination, and we cannot stress that enough. It is very, very unfortunate that we have to report that only 22% of the folks who end up on our COVID unit have been vaccinated, and that's an alarming number. However, it is not any different than watching the news every night and hearing the same thing that's being reported nationally. And so the vaccination status is a crisis, and we're seeing that here locally too. Our COVID unit typically holds 7 people, 8 people. This morning we're at 10, and we do not expect that number to decrease. We continue to expect that to climb. And so I know that there are a lot of questions, just simply because if you were to look at the hospitals in our region, whether you're talking about Good Samaritan Hospital, Greene County Hospital, Terre Haute Regional Union Hospital, you will find that all of the hospitals in our region are essentially in the same boat. And that is, we're seeing very large numbers of people coming into the ER. And so if you do come into the ER, you can expect your wait times to be quite high, no matter where you go. And then you could also expect that our census, and we're capable of holding 25 patients, may in fact be a lot larger than 25. And I know that there's some concern in our community, if I show up into the ER and I'm very sick, will I be turned away? No, you will never be turned away for care. However, you might see that it takes longer for us to get to you and to see you and diagnose you and come up with a disposition or a treatment plan. And so we ask you to be very, very patient with us as we continue to see these high volumes. And then the other important thing, again, going back to the vaccination, is that the hospital still has availability of the Pfizer vaccine. And so that is a clinic that's offered as a walk-in basis on Monday, Wednesday, and Thursday. And you can get on the website, you can get on social media and find out the times that we're offering that vaccine. You can also get on to My Shot, and there are plenty of places in the surrounding area, including our county health department, that are offering the vaccines. And so again, just extremely important to be vaccinated. And also, as you may know, we're getting ready to go into flu season. And the presentation of both COVID and flu is very similar. And I'm sure, Dr. Dupree, that you would encourage people to get their flu vaccine as well.
Yes, the worst scenario, we have a big influenza epidemic on top of this. Last year we didn't have much influenza because people were wearing masks, they think. Today people are not wearing masks. But flu can kill too. I used to always, especially impress the people who have to work, get a flu shot. You can't stand being sick for 7 days. Get that COVID shot so you're not down for 2 to 3 weeks or not able to breathe for months.
Right.
It's a real bad disease. It's just not a cold.
And we are offering a drive-through flu clinic that will be done at the Civic Center here in town, and that will be September 20th. And September 30th. And so you can get on our social media, on our website, and find out information about that. I think that we've covered the majority of things that we'd like to cover. I know that we have talked about just the rise in the number of positives that we're seeing, the effect that's having not only in quick care, ER, and in our hospital, but the fact that the vaccination is so very important, the fact that we're seeing younger people get this disease, and the fact that we're seeing younger people die. And unfortunately, that's happened in our hospital already. And so we would both encourage you to get not only your flu shot, but also your COVID vaccine. And then to practice good hand hygiene, to wear your mask in public, to make sure that you're taking this very seriously, that if you're quarantined, you stay quarantined, and if your symptoms progress, that you seek out health care to resolve that, whether that's calling your primary care physician, or if you need to, certainly coming into the ER. And anything else you'd like to add, Dr. Dupree?
Economically, this has cost $17 trillion by July, according to statistics I had. So not only are people getting sick, but then they're coming home and they're losing benefits. They don't have a place to live. They can't make their payments. So there's many, many reasons to fight this war on COVID.
And finally, we would both like to sincerely give our appreciation to our wonderful staff here at the hospital. And you know, just like everybody else who works in healthcare today, people are working extra shifts. They're working longer hours. They're seeing significantly bad outcomes in the people that they're taking care of. And yet our staff is showing up every day, coming in to work those extra shifts and delivering great care while they're doing it. And so Dr. Dupree and I are both so very appreciative of the hard work that our staff is doing during these pandemic times. It's just absolutely unprecedented. And so we just simply can't thank our staff enough. We genuinely appreciate the care that they provide.